Hi, Ms. Lewis.
Hello.
I'm Kathryn Keating. I'm a student occupational therapist at the University of St. Augustine. I'll be working with you today.
Okay.
Could I get your first and last name and your date of birth?
Jade Lewis, 728.
Thank you very much. Nice to meet you, Ms. Lewis.
Nice to meet you.
So I saw that you have a recent total hip replacement on your left side. So today we're going to be practicing some lower extremity dressing using a sock to put on and off your socks. And then a little later we'll practice some toileting. So while we do this, I just want to remind you of your hip precautions. You don't want to break 90 degrees at your hip. You don't want to let your toe turn inwards, and you don't want to cross your legs at all during these activities. So the first thing we're going to do is use this sock aid to make it easier to put your socks on, and then you can use this reacher to make it easier to take them off. So the way you do that is you roll up the sock to the end, so you just have the toe showing, and then you're going to slip it on the sock aid, and then you're going to straighten it out all the way up to the ropes that are at the top. And then I'll slip off my shoe and just show you how it works. So you're going to hold these handles and throw the sock down on the ground. Then you just place your toe in it, and then you just pull up and let it just glide up right your leg and just pull straight up. And then you have your sock on.
Okay.
Then when you want to take it off, you can use this reacher, and you can just slip it on right underneath the sock to just pull it off. Okay, so that's how you make it a little bit easier, and to make it harder would just be how you usually put your socks on and take them off by like crossing your legs or something like that. But we don't want to do any of that with your hip precautions until the doctor clears you. Okay? So is it okay if we practice that real quick?
Yes.
Okay. So here's the sock aid and the sock, and I'm going to have you do it yourself.
So I scratch this up
Yep.
and put it on the end. This.
Very good. And it's all straightened out.
I'm going to drop it down to the floor and put my foot in.
Mm-hmm. And then pull straight up. Very good. Good job.
Thank you.
So let's practice taking them off real quick using the reacher. You just pinch it and it grabs a hold of it and slide right off. Very good. Do you have any questions?
I do not.
Okay. So today we're going to be practicing toileting. Since you just had a hip replacement on your left side, we're going to make sure that you are following your hip precautions while we're doing this. So you don't want to bend your hip past 90 degrees. You don't want to let your toe internally rotate and turn inwards. And you don't want to cross your legs. So while we do this, just remember those and don't break any of them. So to make this easier, I've put a raised toilet seat with handlebars on the toilet. That'll help you have less travel to sit down and to stand up. And then to make it harder, we could take away those handlebars. But I think the safest way right now is to have them there so you have something to push up from and reach for. So the first thing we're going to do is I'm going to have you scoot your hips forward to stand up so that you don't break your hip precautions. And then you're going to push up from your armrests to stand, leading with your hips and then your upper body, and grab hold of the walker. Then we're going to walk over to the toilet. Then once you get there, once you feel the toilet on the back of your legs, you're going to reach back for the handlebars, and then leading with your shoulders and then your hips, you're going to sit down on the toilet. And then make sure while you're sitting here, you're not breaking your hip precautions. And then once you're done, you can again lean with your hips to stand up, grab hold of the walker, and then we'll walk back over and you can have a seat back down. Remember reaching back and then sitting down with your hips. Do you have any questions before we practice that?
No.
Okay, can you repeat that back for me?
Yes. First I'm going to slide forward with my hips leading first, and then I will use my walker to grab hold to. And then I'm going to walk over to the toilet seat using the raised toilet seat. I'll grab a hold of the handles, keeping my hips forward and then lowering myself down. And the same when I stand up. I will again use the walker, leading with my hips, and then walking back over to my wheelchair. And once I feel the back of the seat on my legs, I will go ahead and lean back, not breaking my hip precautions of no bending at the waist and moving my toes inward or crossing at the legs.
Okay, very good. Is it okay if we practice this today?
Yes.
Okay. So first, I'm going to put this gait belt on you just in case. You may feel lightheaded or dizzy once we stand up, so I just want to be there just in case. Can I have you slide your hips forward for me? Very good. Let me know if you ever feel dizzy or lightheaded once we stand, or if you have any pain. Is that too tight?
No, it's fine.
Okay, so I'm going to remove these. Okay, now I'm going to have you push up with your hands on the armrest, leading with your hips, and then you're going to grab a hold of the rocker. Ready? 1, 2, 3. Very good. How do you feel?
Pretty good.
Okay, so we're going to head on over to the toilet seat. And start turning it to the left. Good. Once you feel the back of the toilet, you can reach back for the toilet seat. Very good. Remember going back with your shoulders first so you don't break those hip precautions, okay? All right. So when you're here, you want to make sure you have maybe a roll of toilet paper up close to you so you don't have to bend over it and reach for it. I know mine at home is right next to me, so maybe you don't have that problem, but just be mindful of that before you get in this position.
Okay.
All right, so we can go ahead and stand back up again. Remember to push off from your armrest and lead with your hips. Very good. All right, and we can head back over to the wheelchair. Remember not to internally rotate that leg. Good. Now reach back. Very good. Do you feel okay?
Yeah. Hello, my name is Jade. I'm a student occupational therapist from the University of St. Augustine. How are you today?
Good.
Good. Can I have your name, first and last, and your date of birth?
Kathryn Keating, 12/25/92.
Awesome. Thanks for sharing that with me. So I understand that you've had a spinal surgery recently.
Yeah.
So today what we're going to be working on is getting you in the shower and teaching you how to put your socks on so that you can do that independently. Now, before you do that, I will have to share with you the precautions of that. So that's no bending, lifting, or twisting. Easy to remember. You're also not able to drive because with driving you do have to twist to look over your shoulder. And no sitting or standing longer than 30 minutes, okay? If you are sitting, I want you sitting on a firm surface and not anything too soft, okay?
Okay.
But the benefits of this is you will be able to do all those things like showering and dressing yourself independently without my help. Does that sound like something you would like to do?
Yes.
Okay. Can you repeat that back to me? Your precautions, please.
Yes. So there's no bending, lifting, or twisting, and that means I can't drive because you have to twist to look behind you.
Yes. Okay. And don't forget no sitting.
Yes. Just sitting with the walker.
Okay, so the first thing I'm going to be teaching you how to do is to put your sock on. The harder way to do this is to actually bring your leg up to you and cross it over, okay? So you would just grab your sock and put it on just like normal. Go ahead and roll it up. And put it on just like this, okay?
Okay.
And, you know, once you're done and you're ready to get yourself undressed, you would do the exact same thing. Bring your leg up and unroll it off, just like that, okay? Now, let's say you are unable to bring your leg up to you. Easier way to do this would be the use of a sock aid. And so when you're using the sock aid, all you're going to do, you're going to do the same concept. You know, go ahead and scrunch it up and put the sock on the sock aid, just like this. Okay, making sure the toe portion is at the bottom, and then just bringing it up just like this. And once you have the sock all the way up on the sock aid, you can go ahead and drop it down to the floor. Point your toe in there and pull it up just like that, okay?
Okay.
And if you're, again, not able to bring this around, you would just go ahead and use this reacher to take it off. And what that would look like is just going ahead, grabbing hold of that reacher, and pulling the sock off. Just like that. Okay? Easy enough, right?
Mm-hmm.
Okay, I want you to try the hard way first. Do you think you'll be able to do that?
Yes.
Okay. So let's try that. Go ahead and bring your leg up and put the sock on. Good. So go ahead and just take it off just like that. Okay. Would you like to try the easier way?
Sure.
That's a sock aid.
Like that?
Yep, just like that. And make sure you go ahead and drop down to the floor. You put your foot in and slide it right up. Awesome. Now you would just use the reacher to get it off. Great. Easy enough, right?
Yep.
Good. Do you have any questions for me?
Yeah.
So today we're going to be teaching you how to do some bathing activities, since I know you just recently had spinal surgery. What that entails is getting it up out of your chair and using this walker, okay? So to begin, I just want to remind you of your precautions, which includes no bending, which looks like bending straight over at your back, okay? No twisting, okay? And no lifting anything that's heavier than 10 pounds. So what this will look like is you're going to just push straight up from your chair, just like this, keeping your spinal precautions, okay, with no bending, twisting, or lifting. And you're just gonna use your walker and walk normally towards the shower, okay? Now, when you're standing up, you might feel a little bit dizzy or woozy or anything like that, but it's okay to just take a pause and a second to catch your breath. All right, so then we're just gonna turn our walker this way. Okay, and I'll have you use the sink to grab hold to if you need it. And what you're gonna do from here is you're just gonna go ahead and step right into your shower and face it, right? And the hardest part is doing this standing up. So you'll be able to complete all your grooming tasks and washing your back, washing your legs, washing your stomach, and you'll be able to reach that using this reacher, okay? And after that, you'll go ahead and use this shower head to rinse off every area of your body, remembering not to twist or bend or lift anything. Now, to make this a little bit easier, you can go ahead and use the shower bench. So you can just go ahead and sit straight back, keeping your spine straight, and you will again use this sponge, washing your legs, getting your feet, your arms, and your back. You can even wash your face. And again, you'll still be able to reach the water head, and you'll go ahead and rinse off every part of your body. Okay, now while you're doing this, I will have a gait belt on you for safety reasons, but it won't be too tight. So once you're done with your shower, you can go ahead and stand up, keeping your precautions in mind. Turn and face your walker. Your walker will be right there. Lift your legs over, clearing the tub. Use your walker, and you'll walk right back to your chair. And when you get to your chair, that's where you can perform your drying off, or you can do that standing. So what that would look like is just getting your towel and drying off is normal. And again, you don't want to stand no longer than 30 minutes. So if you get tired, you can go ahead and reach back for your chair and sit down to continue drying yourself off. And the same with the shower. If you get tired in there, you can reach back for the tub bench and wash yourself or dry yourself off. Does that sound like something you would like to do?
Yes.
Can you repeat that back to me?
Yes. So I'm just going to walk over to the shower like normal without breaking my spine precautions, not bending or lifting or twisting. And then if I get tired, I can sit down. I'll use the long-handled sponge to wash myself and the shower head to rinse myself off, and then just dry myself off like normal or sit down and dry myself.
Okay. Does that sound like something you would like to do today?
Yes.
All right, let's do it. Okay, so we're gonna go ahead and try showering today, okay? So I'm going to put your gait belt on, and then I'll take these off for you, okay?
Okay.
All right, so I'm not going to put this on too tight since you've just had spinal surgery. So don't worry about it hurting you, but it's just for safety precautions. Can you go ahead and lean forward for me? Good. You still doing okay?
Mm-hmm.
All right. Is that too tight for you?
Nope, it's
No?
good.
Good. Okay. So now I'm just going to remove the leg rest from the chair so that we're able to walk. Alrighty. So what you're going to do, Ms. Keating, is you're just going to go ahead and push up from your chair like normal. I'll be holding on to the gate belt, and once you're pushed up, I want you to grab hold of this walker, okay?
Okay.
All right. I'll give you a count of 3. 1, 2, and 3. Push up. Good. You have your balance?
Mm-hmm.
You doing okay?
Mm-hmm.
Okay. So now I want you to turn your walker to the left for me. Good. Keep going. And good. All right. So now what you're going to do is hold on to the sink and use that as a guide to go ahead and come towards the shower. So you can go ahead and step in. Good. You doing okay?
Mm-hmm.
All right. So now you would try your showering technique using the sponge and just try, getting your back, and your face, and your legs. And this is how it would be during standing. Of course, it would be hard doing this. And then go ahead and grab the shower head and try to rinse yourself off. Not too bad, right?
Mm-hmm.
Okay. And again, if you get too tired or if you're in here longer than 30 minutes, I want you to go ahead and sit back. This will be the easier way. Remembering your spine precautions and no bending, lifting, or twisting. You can go ahead and grab that sponge. And you would do the same thing. You get your feet, your legs, your back, your arms. So now you can go ahead and grab your shower head and continue rinsing yourself off. Good. And once you're done, you can go ahead and push off to stand up, keeping your spine straight. And just turn, remembering not to twist, and go ahead and step out. Good. And grab hold of your walker. Good. So now you're just going to walk. And what I want you to do is turn your walker to the right. Good. And back until you feel the back of the chair on your legs, and go ahead and reach back, keeping your spine straight. Good. You comfortable?
Yes.
Good.